first question for you is, what is the leading and most important vascular problem in the USA today, in your opinion?
That's a really good question. I mean, I think vascular disease in general is exploding in the United States and worldwide. So I think as the population ages, we're seeing more atherosclerotic disease, of course venous thromboembolism. I think atherosclerosis and venous thromboembolism are the most morbid problems that we're dealing with. But I also think other conditions like chronic venous disease and superficial venous disease is just so common, and it causes symptoms even though it's not as life-threatening as atherosclerosis or venous thromboembolism.
For the second question is, as a scientific chairperson, what are the fundamentals in coming up with a good versus an excellent program?
Okay, good question. I think the most important fundamental is sort of taking a look back at what your audience wants. What are the needs of the group? Do they want education on the hot topics? Do they want discussion of science, more basic sessions? And what we tried to do with the program this year is really have something that would appeal to everyone. So we had some programming that went over the very basics, the ABCs of vascular disease. And then we just left the session where they presented these very complicated, most unusual cases for the more advanced practitioner. And then in between, we have some state-of-the-art updates on latest research. We have an opportunity for people to present their research to the group. We have some hands-on workshops. So I think diversity of the program and appealing to all levels of expertise in vascular medicine.
Okay. Coming to the third question, can you share to us your research interests and what are in the pipelines for your research?
Sure. So I spend most of my time currently in research focusing on fibromuscular dysplasia, which is an unusual arterial disease that affects mainly women. And I also spend a fair amount of time studying related conditions like carotid dissection and aneurysm. Do you see fibromuscular dysplasia in the Philippines?
Not so common, but I think it's more of our index of suspicion is lower for that, but I think if we were educated on that, we're able to find more cases.
But I'm currently very actively involved as one of many people working on the United States Registry for Fibromuscular Dysplasia. We actually just had an abstract presented here at this meeting, and we now follow almost 1,500 patients with fibromuscular dysplasia. It's one of the largest, if not the largest, cohorts of patients that we're following. And the abstract that was presented in this meeting from the registry showed that among women with fibromuscular dysplasia who undergo imaging of the cerebrovasculature, the prevalence of brain aneurysm is almost 13%. So very high, and really supports the concept that patients with fibromuscular dysplasia need to be screened for aneurysms.
Are there any racial differences that you find with fibromuscular?
Yeah, it's a good question. We haven't started to look at those questions, so I think that'll be something we look at in the future.
Fourth question, on a personal note, who or what inspired you to go to vascular medicine?
That's a really good question, and I have a pretty easy answer. It was my mentor, Dr. Mark Krieger, who is a past president of the Society for Vascular Medicine and the current president of the American Heart Association. And I had an opportunity to work with him and his group when I was in my cardiology fellowship, and I just really inspired by his approach and his clinical style and his approach to research, and I really wanted to work with him in his group, so that's how I kind of caught the bug. And then I also always have loved physiology, so I love the physiology of blood vessels and vasodilatation, constriction, the hydraulics, if you will. So I love the vascular lab. So I was really drawn to the lab, and I had a chance to train in the vascular lab with some great people. Gerhard Herman, who trained me in the vascular lab, Josh Beckman. So I think it's a combination of great people plus interest in physiology.
Okay. In terms of vascular ultrasound, do you have any fearless prediction on how it will be 10 to 15 years from now?
predict that it's going to be a lot more common. So I think there will be some technological advances. I'd love to see more use of ultrasonic contrast agents, especially for abdominal work. But I also think it's just going to be used more commonly because it's so cost effective, it's so low risk. So I predict it's going to have more and more of a role in the care of vascular patients. I mean, why do you need to do fluoroscopy to do your procedure? Why not do some ultrasound guidance? So I think we're going to see more and more use of ultrasound.
I've seen that in the commercials they have a provider that gives out like a comprehensive ultrasound for about $200. Was interested?
I think that's there is something in the U.S. where we have some vascular screen use. Is that what you're referring to, where they'll do a carotid study in the aorta?
Third party, outpatient, and then they go to the community.
Yes, that I know the group. Yes, they do community-based screenings.
How about apps? Like technology apps?
You know, I think I definitely think there's a role for apps. For example, I was involved with a group at Cleveland Clinic that helped develop a remote anticoagulation monitoring system, and I could see that more and more going into an app format. I think more and more patients are using technology to communicate with their providers. I'd love to see an app for supervised exercise. Wouldn't that be cool?
Yes.
I think for doctors, there's a lot of like apps with risk calculators. I think could be really helpful. And I also think another thing with technology is I think the like social media I think is having a big role in medical education and connecting groups. And for example, here at this meeting we had a whole Twitter campaign, and there was a period during the meeting where we were trending on the list worldwide of the most trending in terms of the most people currently tweeting, and just people disseminating information using technology to people who can't be at the meeting.
One of the last questions. Do you see SVM being an international leader in furthering vascular medicine, and how?
Well, I would love it to be. I think we continue to develop here in the United States. We currently have 500 members. I think we should have thousands more. I think this is an amazing organization with great content experts and people who are very passionate about vascular disease thought leaders. I think it's been a challenge. It's been a slow growth, but then we think when the society was first started before my time, that 27 years ago, there were 13 members.
That's a long time ago.
It's a long time. It's been present for 27 years. We'd love to have more international collaborations. I know the vascular medicine group in the Philippines is very active, and we're always, all of us here, so impressed when the contingency comes over to our meetings, and would love to see more collaboration internationally, perhaps with your group.
And lastly, what will you do if Donald Trump wins the presidency?
Can I move to the Philippines?
You're most welcome.
That's all. Thank you for your insights. My pleasure. Bye-bye.
Thank you.
Thanks.